Do you know the #1 cause of falls in seniors? For many older adults, a simple misstep can lead to a life-changing injury. Falls are one of the most common reasons people over 60 end up in the hospital, and they can affect more than just the body. A fall can shake your confidence, limit your independence, and make even simple daily activities feel risky. But here is the important truth. Most falls are not accidents that cannot be avoided. In fact, many of the risks can be understood, managed, and prevented with the right approach. That is what we are going to talk about today. In this video, we will uncover the most common causes of falls in seniors, from weak muscles to hidden hazards at home, and I will share doctor-approved strategies you can use to protect yourself. These tips are simple, practical, and proven to help you stay steady, safe, and independent. By the end of this routine, you will not only know why falls happen, but also how to stop them before they occur. 1. The real risks of falling. When we talk about falls in seniors, we are not just talking about a minor trip or stumble. The truth is, a fall can have serious and lasting consequences. For adults over 60, falls are one of the leading causes of injuries such as hip fractures, broken wrists, or head trauma. Recovery from these injuries can be slow and difficult, sometimes requiring surgery or long rehabilitation. In many cases, the physical pain is only part of the story. One of the biggest hidden risks of falling is the loss of confidence. After experiencing a fall, many seniors begin to fear moving the way they used to. Activities like walking outside, climbing stairs, or even standing in the kitchen can feel unsafe. This fear often leads to reduced activity, which weakens the muscles further and actually increases the chance of falling again. It becomes a cycle that is difficult to break. Falls can also impact independence. Something as simple as dressing, bathing, or shopping can become challenging, requiring help from others. For many people, this loss of independence is harder to accept than the physical injury itself. That is why preventing falls is so important. By addressing the risks early and building safer habits, seniors can protect not just their health, but their freedom, confidence, and quality of life. 2. Common causes of falls. To understand how to prevent falls, we first need to look at why they happen so often in older adults. Most people think falling is just bad luck, but in reality, there are several common causes that can be identified and addressed. One of the leading causes is muscle weakness. As we age, our muscles naturally lose strength, especially in the legs and core. Weak muscles make it harder to steady ourselves when we stumble or change direction quickly. Without the strength to support the body, even a small trip can turn into a dangerous fall. Another major factor is poor balance. Balance relies on the coordination between your eyes, inner ear, muscles, and brain. With age, these systems may not work as smoothly as before. Vision changes like cataracts or glaucoma, reduced sensation in the feet due to conditions such as diabetes, and slower reflexes all make it harder to stay steady. Medications also play a role. Many prescriptions used to manage blood pressure, sleep, or pain can cause dizziness, drowsiness, or changes in blood sugar, all of which increase the risk of falling. Often seniors take multiple medications, and the combined side effects make balance even more difficult to maintain. Environmental hazards are another hidden cause. At home, clutter on the floor, loose rugs, poor lighting, and uneven surfaces are some of the most common reasons for trips and slips. Even things as simple as wearing slippery socks or not having handrails in the bathroom can turn into major risks. Lastly, fear of falling itself can contribute to falls. When someone is overly cautious, they may move stiffly, look down constantly, or avoid normal activity. Ironically, this leads to weaker muscles, slower reactions, and more imbalance, which makes falling more likely. By recognizing these common causes: muscle weakness, poor balance, medication side effects, environmental hazards, and fear of falling, we can see that falls are not random accidents. They are predictable and, more importantly, preventable. The next step is learning how to manage these risks with practical, doctor-approved strategies that keep seniors safe and independent. 3. Doctor-approved prevention strategies. Falls are not random events beyond your control. Doctors emphasize that most falls result from a handful of predictable risks that can be reduced with steady, practical changes. The goal is simple and powerful at the same time. Build a body that reacts quickly, create a home that does not surprise you, and keep your senses and medications working for you rather than against you. None of this requires extreme effort. What it asks for is consistency, a little planning, and the willingness to make small upgrades that protect your strength, confidence, and independence every single day. First, make regular strength and balance exercise a non-negotiable part of your week. Muscles in the hips, thighs, calves, and core are your natural anti-fall system, and they respond well to gentle but frequent training. Doctors often recommend short daily sessions because they are easier to maintain than long, exhausting workouts. Think of patterns rather than intensity. Chair sit to stands build power for getting up safely. Heel raises teach the ankles to react when you wobble. Side leg lifts strengthen the hips that keep you centered when you step sideways or turn. Simple balance drills, like standing on one leg while holding a countertop, retrain your nervous system to make tiny corrections before a slip becomes a fall. The magic here is repetition, not strain. When in doubt, start with fewer repetitions, move slowly, and breathe steadily so the brain learns the movement as well as the muscles. Progress these exercises thoughtfully. Begin with both hands supported on a stable surface, then shift to one hand, then a light fingertip, and eventually no hands when you feel ready. Lower the height of a heel raise or the depth of a squat on days you feel stiff. Raise them slightly on days you feel strong. If dizziness, chest pain, or sharp joint pain appears, stop and rest, then discuss it with a healthcare provider. Gentle practice most days of the week builds the reserve you need for real life. When a curb is higher than expected, or a grandchild runs into your arms, and you pivot quickly. The outcome you are seeking is not a perfect workout. It is a body and brain that stay calm and coordinated when life moves fast. Second, make your home a safer partner. Doctors see again and again that the living room, bedroom, and bathroom are the places where the majority of falls occur. Start with light. Nighttime trips to the bathroom are risky because sleepy eyes and dim halls hide hazards. Add motion-sensing lights in the bedroom, hallway, and bathroom, so the path is bright before your first step. Next, tame the floors. Curled rugs, power cords, pet toys, and low stools are ambushes waiting for a foot to catch. Clear the main pathways and secure any remaining rugs with firm, non-slip backing. Arrange furniture so there is a clear lane from bed to door, sofa to kitchen, and chair to bathroom. The less weaving your feet must do, the steadier you remain. Bathrooms deserve special attention because water and smooth tile create the perfect conditions for slipping. Install grab bars near the toilet and inside the shower, not towel racks that can rip away. Place a non-slip mat in the tub and a second one just outside it so the first step out lands on firm footing. Consider a shower chair if standing makes you uneasy. In the bedroom, check the height of your bed. If it is too low, you collapse downward and struggle to stand. If it is too high, you slide off the edge. Aim for a height that lets your feet plant flat on the floor and your knees bend comfortably when you sit. On stairs, use handrails on both sides and add high contrast tape to the edge of each step so depth is obvious in low light. Outside, keep walkways even and clear. Sweep leaves, repair loose bricks, and store hoses where they cannot snag an ankle. Each small improvement removes a chance event from your future. Third, keep your vision and hearing current because your senses are part of your balance system. Clear eyesight helps you detect edges, read floor textures, and judge distances. If letters blur or lights glare, your brain receives confusing information and your feet hesitate. Regular eye exams catch cataracts, glaucoma, and macular changes before they quietly erode your safety. If you use bifocals or progressive lenses, be extra careful on stairs where the lower lens can distort the edge of a step. Many doctors recommend looking through the distance portion or slightly tipping your head so the stair edge is crisp. Good lighting completes the picture. Brighter bulbs and open blinds during the day reduce shadows that hide hazards. Hearing matters more than many people realize. The inner ear houses the balance organs that tell your brain which way is up. Even modest hearing loss or inner ear irritation can make you feel off kilter, especially in busy places with competing sounds. Schedule hearing checks regularly, and if a provider recommends treatment or hearing aids, consider them tools for balance as much as conversation. If you ever experience vertigo, ringing, or a sense that the room spins when you turn your head, seek evaluation. Vestibular therapy can teach your brain to settle quickly after head movements and can be the difference between feeling cautious and feeling confident. Together, sharp eyes and tuned ears act like early warning sensors that keep your steps accurate. Fourth, review medications with the same care you give to exercise and home safety. Many necessary drugs can also create side effects that nudge you toward a fall. Blood pressure pills can lower pressure too quickly when you stand, a problem called orthostatic hypotension that makes the world dim or spin for a few seconds. Sleep aids and some pain medicines can leave you groggy in the morning or slow your reflexes through the day. Drugs that relax muscles may also relax the small stabilizers that keep your ankles and hips steady. The solution is not to fear medication but to manage it actively. Bring every bottle, including supplements, to a pharmacist or doctor at least once a year and after any hospital stay. Ask which combinations increase fall risk, whether timing can be adjusted, and what symptoms should prompt a call. Adopt daily habits that reduce medication-related wobbles. Rise in stages rather than all at once. Sit at the edge of the bed, flex your ankles a few times, and take a deep breath before standing. Drink water steadily through the day so dehydration does not amplify dizziness. Eat consistent meals if a drug interacts with food. Use a simple pill organizer and a checklist so doses are never doubled or missed. If a new prescription makes you feel lightheaded, foggy, or unusually tired, speak up quickly rather than hoping it passes. Doctors would rather adjust a dose than see you risk a fall. With a few careful steps, you can enjoy the benefits of your medicines without sacrificing steadiness. Fifth, upgrade footwear so every step supports you. Shoes are the foundation of your posture and the first line of defense against slips. Look for a snug heel, a broad base, and a firm, flexible sole that bends at the ball of the foot but does not twist like a towel. Traction matters, so choose patterned rubber rather than smooth leather. Low heels are safer than high ones, and a secure closure with laces or straps keeps the shoe from sliding off when you pivot. Indoors, avoid walking in socks on hard floors unless they have non-slip grips. If your feet hurt, your body will adopt protective patterns that actually make you less steady, so address foot pain rather than ignoring it. A podiatrist can guide you toward cushioned insoles, toe spacers, or shoe shapes that relieve pressure from bunions or hammer toes. Comfortable, supportive feet make confident steps. Small accessories can help here as well. A simple long-handled shoehorn prevents wobbling as you put on shoes. A bench near the door invites you to sit while tying laces rather than balancing on one foot. If you use a cane, make sure it is the correct height so your shoulder does not hike up. A wrist crease height with the tip on the floor is a useful guide. Replace cane tips when they wear smooth. These minor details reduce the tiny stumbles that add up over time. Bring all 5 strategies together with an action plan that fits your life. Tomorrow morning, practice 2 or 3 strength and balance moves while the kettle boils. In the afternoon, take a slow walk through your home and notice what could trip a distracted foot, then fix one thing right away. Before the weekends, place a call to schedule eye and hearing checks if they are due. Gather your medications on the kitchen table and make a list for your next appointment, including any moments of dizziness you have noticed. Try on your most used shoes and assess their grip and support. Retire pairs that slide or wobble. None of these steps require perfection. What they require is a steady commitment to small improvements that stack up into real protection. Remember that fear of falling can quietly change how you move. It makes steps shorter, turns stiffer, and eyes glued to the floor. Doctors encourage a different approach. Lift your gaze to where you are going so your body follows your eyes. Turn your whole body rather than twisting just your feet. Take your time when standing, and let others know you prefer a steady pace to a hurried one. Confidence grows from experience, and every safe repetition rewires your brain to trust your balance again. If fear feels heavy, consider a few sessions with a physical therapist who can measure your balance, teach targeted drills, and show you the exact progress you are making. Evidence of improvement is a powerful antidote to worry. Finally, protect your independence with simple safety nets. Keep a charged phone within reach and consider a wearable alert device if you spend time alone. Place a small table next to your favorite chair so drinks and remotes are within easy reach instead of across the room. Store heavier kitchen items at waist height so you do not climb or bend deeply to get them. Ask family members to help with seasonal tasks that demand ladders or awkward lifts. Independence is not doing everything yourself. It is making smart choices that let you do the important things for many more years. These doctor-approved strategies turn prevention into a daily practice. Stronger legs and a steadier core help you recover from slips. A safer home removes hidden traps. Clear vision and tuned hearing sharpen your awareness. Wise medication management keeps your head clear and your blood pressure stable. Supportive shoes anchor every step. When you weave all of these together, you create a life where movement feels secure, outings feel enjoyable, and confidence returns. The result is not just fewer falls. It is more freedom to live the way you want, with the people you love, doing the things that give your days meaning. 4. Building daily habits for safety. Prevention is not only about exercises, home modifications, or medical checkups. True safety comes from the small choices you make every single day. These daily habits may seem simple, but they add up to powerful protection against falls and injuries. Start with how you begin your morning. Many falls happen right after getting out of bed, when blood pressure is still low and joints are stiff. Instead of standing up quickly, take a few minutes to sit at the edge of the bed, flex your ankles, and breathe deeply before rising. This allows your body time to adjust and reduces dizziness. When you do stand, plant both feet firmly and rise slowly, giving yourself a steady start to the day. Make a habit of checking your environment as you move through your home. Before you walk into a room, glance at the floor for clutter, cords, or loose items. Turn on the light instead of trusting your memory of the space in the dark. Build the reflex of reaching for handrails on stairs and grab bars in the bathroom every time, not only when you feel uncertain. Repetition turns these actions into automatic safety responses. Daily movement should not be limited to structured exercise. Look for ways to practice balance naturally. Stand on one leg while brushing your teeth, shift your weight from side to side while cooking, or take a few extra steps during commercial breaks when watching TV. These mini-sessions train your body just as effectively as formal workouts, especially when done consistently. Pay attention to footwear throughout the day. Put on supportive shoes as soon as you get out of bed, rather than walking in socks or slippers. Check your soles regularly for wear, and replace shoes that have lost their grip. Keep a comfortable pair by the bed so you never need to cross the room barefoot at night. Hydration and nutrition also play a hidden role in fall prevention. Dehydration can cause dizziness, while skipping meals may lead to weakness or sudden drops in blood sugar. Drinking water regularly and eating balanced meals helps your body stay strong and steady. Finally, cultivate awareness. Avoid rushing, even for small tasks. Take your time when answering the phone, getting to the door, or stepping off a curb. Pause before changing direction quickly, and give yourself permission to move at your own pace. These mindful habits reduce risk and build confidence. By weaving these daily habits into your routine, you create a lifestyle that supports safety automatically. Instead of worrying about falls, you can focus on enjoying your day, knowing that each choice you make is reinforcing your stability, independence, and peace of mind. You have now learned why falls are such a serious concern for seniors, what the most common risk factors are, and, most importantly, the doctor-approved strategies to prevent them. From strengthening your muscles and practicing balance, to making simple changes around the home, staying up to date with vision and hearing, managing medications wisely, and choosing proper footwear, every step you take builds a safer, more confident life. Remember, prevention is not about fear, it is about freedom. When you feel steady on your feet, you gain the confidence to keep doing the things you love without hesitation. Now I would love to hear from you. Have you experienced a fall before? Share your story in the comments below. It may inspire someone else to take action. And if you found this video helpful, please like it and subscribe to Seniors Mobility. Our channel is dedicated to giving you the tools, knowledge, and encouragement to stay active, safe, and independent at every stage of life. Together, we can make aging not about limitation, but about living fully, freely, and with strength.